So we generally start our cases by doing an S-bar handover. So we're on labor wards. We are being handed over a patient, or just about to see a patient who's 38 years old. She's gravid of 3, para 1, having had 1 1-2 delivery in the past and 1 miscarriage at about 10 weeks. She's pregnant, currently at around 38 weeks, and she's coming for induction of labor for growth-restricted baby and reduced fetal movements. The background history is that she booked at 7 weeks. She previously, as I said, had a previous 1-2 delivery with a baby that was 2.6 kilograms at the time. She's otherwise known to be asthmatic on inhalers. She has thalassemia trait with mild anemia. She has a normal BMI of 24.8. The plan at the beginning of the pregnancy was that because of the previous IUGR baby or small baby, she is to have serial growth scans, and her serial growth scans up until this point had shown that the baby had dropped to the 13.9 centile at 36 weeks, and then 9.6 centile with another estimated baby fetal weight of 2.6 kilograms at 38. When she was questioned about it, she said that at the time that the movements were not that great, hence the decision for induction of labor. Okay. So this is the handover that we have. We go through her previous notes, and we see that at 36 weeks, when she had the growth scan, this was her CTG trace. And at the time, it was commented that the baseline was about 140 with an accelerative and happily moving baby. Can you see that?
Yeah.
And when she had come in for induction again, the beginning of the trace was the baby was active and it was still moving, and the baseline was pretty much the same. Hence, they proceeded with the induction. She had the propus inserted, and the traces as she has the propus remain pretty much the same, with the baseline running once again at about 140 with accelerations when it moves. She seems to be starting to get some contractions. Okay, this is a better picture of the trace. So looks like she's getting maybe 2, 3 in 10 contractions. Okay, and she earlier, just before that, she had prostin, which is, so she had a propus, which lasted for 24 hours, and then had a dose of prostin, which is now triggering those contractions. And this is her last trace when she was on the ward before she gets transferred to labor ward. So what do we expect to see on the trace when we're going into labor ward now, or going in to see the lady now? We could see that the baseline was 140. Remember, this is a term baby. It had started, it was 142 weeks ago. So yeah, pretty much that's our baseline. And there seemed to be some decelerations on the trace. So the baby was initially happily moving and it was accelerative, but then towards the morning, I can't see any more accelerations, and there are some what look like cord compression, although some of those might be a bit late. So what do we expect to see on the trace on labor ward now? Where would we expect the baseline to be?
Hopefully for the baseline to remain as it was.
Okay, so the baseline might remain at the 140. If the baby's head has come lower, the baseline I would expect the baseline to actually drop even further. But I wouldn't expect, it shouldn't be higher. Yeah?
Right.
Why would it expect, what would I expect the variability to be like?
I would hope the variability would continue to be variable.
So normal. So normal variability is usually between 5 and 25. So on the trace, on the labor, well, on the antenatal ward, the variability looks like it's around 10 most of the time. Yeah. So the 2 small boxes about a 10.
Okay.
Okay. I might expect some accelerations, although there wasn't any at 10 o'clock in the morning. I may also expect some decelerations now that she is more frequently contracting. Accelerations and decelerations tell me that the baby is well enough to respond to its environment.
Yeah.
Okay. So when we walk onto or into the room, this is what we actually see. So the baseline here is coming up to about 145 to 150. Your ability seems to be a bit, I mean, this is quite flat. I would like to see a bit more of this. I can't see any accelerations, and the decelerations seem to be a bit on the shallow side. Yeah. Okay. So shallow decelerations in general tend to worry us because it sometimes tells us that this baby can't respond to its environment. It's struggling to respond. It's like a person who comes to A&E with disturbed consciousness. You pinch him and he barely moves or barely does anything. That's a bad sign. Okay. So as the trace carries on, you could see that this trace is completely flat. Okay. What does that tell me?
I suppose that the baby's not responding to the contractions that are happening.
So the baby's not responding to anything, pretty much. She seems to be contracting quite frequently. So 1, 2, 3, 4. Yeah. And I'm not entirely sure what we're monitoring here, but the baby is showing absolutely nothing.
Yeah.
There's nothing there at all. This baby's brain is in trouble. Remember, this baby was already an IUGR baby. This baby was an unhappy baby to start with. This baby was getting reduced oxygen from the baby's placenta so much that the growth centiles were dropping. Okay. And the trace continues. She is still contracting. We're not monitoring properly, but she still seems to be contracting, and baby is really struggling to respond. And we have a completely flat trace. We like seeing decelerations on the trace. Decelerations mean that baby has enough brain power, brain activity to protect itself. A baby that is not responding tells me nothing. Can't tell me whether it's hypoxic or not. What it's telling me that its brain is really, really struggling. And that's not a good sign. This lady was, when she came to the labor ward at 2 o'clock, she was about 5 centimeters dilated. And within the hour or two, possibly, she became fully dilated at around 1540. She's contracting really well. She's progressing. So labor is progressing. However, this baby is really telling me that it is in trouble. Okay. And we can see that clearly on the trace. The correct management for this baby is to actually stop those contractions completely and try and stimulate this baby again to see that whether it still has any sort of capacity to respond, or do we actually need to deliver this baby immediately by cesarean section? Unfortunately, this did not happen. And the baby continues to be completely flat. Okay. The next stage for this, or the next thing that would happen, would be for this baby's heart to go into heart failure, and this baby to go into terminal heart failure and die. Okay, because we can see that already the brain has no capacity to respond anymore.
Is that reversible at this stage?
Well, brain damage within very short limits can be reversible. However, brain ischemia is very frequently not. So those babies can end up with severe brain damage. And that is a very, very serious thing. Okay, so 4:30, she's being examined again. Apparently they put a fetal scalp electrode in, and I have no idea why they activated STAN, which is the ST analysis part of the trace, which basically means, because STAN monitoring has to be started on a completely normal trace. And this trace is far from being normal. So we can't actually rely on STAN in any way or manner. Eventually, this baby has a vaginal delivery. And can we guess what the outcome of the
I would think there'd be ischemic encephalopathy of the baby.
So the baby came out very, very flat with an APGAR score of 1 at the first minute of life. It did manage to actually pick up, so with some resuscitation, but it did show that it was significantly hypoxic throughout, and it was using all of its reserves to try and compensate. So in reality, the baby did tell us all the way that it was quite unhappy. We should have been paying more attention to this baby, trying to slow down the contractions. The fact that she's a para 1 means that hopefully she can progress in labor quite quickly. But it also means that we need to be very careful because this baby is small. Dragging the baby across, because that's the rate that we need her to progress by, is really not on. Okay, that is not safe, not sensible. The reality is, had we slowed this labor down, we might have actually ended up with the baby that would have had a better outcome. Hopefully, I mean, babies have remarkable powers of recovering and they are very resilient. But equally, IUGR babies have a higher tendency to get damaged, and they get damaged a lot more easily. Does that make sense?
Yeah. Could I ask what sort of duration of time a baby could withstand having that sort of trace, that unvarying baseline and lack of response to bradycardia?
That is very
I
low.
presumed it would be, dependent on what the baby's reserve is.
Yes. So from the beginning, so from 2 o'clock, from the time we looked at the trace at 2 o'clock, this baby is not responding at all. So this baby's brain is already in trouble. The fact that this baby still continued and was born alive, to me, says this baby has fought a big battle. This baby, even though it was growth restricted, it had a huge amount of reserve that it almost utilized completely before it was delivered. Thankfully, this baby was not. I don't know what the outcome of the baby is. I understand this baby is being investigated further in the by the neonatal unit, but I am going to be following up the outcome for that. But obviously, this is a sign of, or this was a baby that we could have intervened much earlier on, and we could have made this baby better, or at least reduce the risk that this baby went through. Even if baby has what we think at this point in time is an okay outcome, we will never be able to see how well this baby's brain is developing for the next 5 years or maybe even longer. Because not all damage presents with a completely handicapped baby. This baby's development can be affected for the rest of its life.
Yeah.
So unfortunately, not a very good case for the beginning of the year, but hopefully it's a reminder that we can definitely do better and we can definitely make these babies safer. And the signs are usually on the trace. The babies tend to tell us how happy or unhappy they are during labor. And this baby was not one of the happy ones. So yeah.